Hello, everyone. Welcome back to another episode of Parenting is Easy, said no one ever. I'm your host, Hanani Abraham, and I had an awesome talk today with Dr. Mike, who is a pediatric dentist based in the Pennsylvania area. We had so many different little smaller tidbits that as a dad, I learned so much from. And I think he himself, Dr. Mike, as a parent, was able to have such an experience as a parent and what he brought into his office and what he shared with us. We talk about different types of toothbrushes, toothpaste, different stages to have different toothbrushes, and anxieties that come about even going to the dentist, and anxieties that can now have an effect and have an impact on the mouth in general. I think there's so many different things that we picked up in this talk. I hope you enjoyed it as much as I enjoyed recording it for you. Again, if you have any questions, concerns, comments, please feel free to reach out and to email. Love if any have any ideas for guests as well. You can email us at parentingiseasypodcast@gmail.com. Doctor, thank you so much for joining us today. And there are so many different topics and places for us to go when it comes to dental work and it comes to us taking care of our teeth. But I'm curious, there's something that I've heard about recently called dentophobia. And I'm curious if you could talk about that, what it is, and how us as parents can prevent the phobia as much as possible.
Excellent. So dental phobia is really just being afraid of the dentist. And in my generation, it was something that most of us were afraid of. Dentists were not trained to be as friendly. Even when I was in school, some of the different techniques that were taught really are no longer acceptable to do as a dentist to a patient. So even in the last 15 years, there's been a real adjustment in forcing treatment and trying to be a little bit less intimidating and scary as a professional, especially when you're working with kids. It's so important.
Yeah, that's a very good point, and I think it applies to all doctors, not just dentists. The concept of that bedside manner, and obviously there's a certain point that is probably needed even more so when it comes to working with kids, and even more so when it comes to dentistry. So, can you just talk about some of the things, I guess, from your experience that you've seen in your office or offices that I guess you could say us as parents can start working on at home to help ease some of those anxieties that are going to be there?
The first thing is getting into good habits early on with your children. So some parents come in and they don't realize that even before your child has teeth, it's really important and really great to start kind of getting your hands in your baby's mouth so that they're used to having hands in the mouth, or even getting an infant toothbrush for them to even just to chew on it, to kind of get used to the feeling of the bristles. We kind of take it for granted because we're adults, that it's a kind of an odd feeling, having bristles in your mouth. It feels kind of weird. So the earlier that you can get started on having your infant familiar with the feeling of bristles and a toothbrush in the mouth, it's going to really help get them more comfortable with it. And also for them to know, because they may not like it at first, but for them to know that this is a part of our routine. This is what we do. This is just something that we do every day. We put the toothbrush in our mouth and we, move it around and kind of brush. And again, you don't even have to have teeth yet to start getting your baby comfortable with that. And they make pediatric infant toothbrushes that are wider so that they can't go too far in the back of the mouth or gag themselves. And then you can be comfortable with your kid walking around holding the toothbrush, that they're not going to, if they fall, it's not going to, hurt them or anything like that.
So walk me through some ages here. When should parents buy that pediatric toothbrush? And is that something that could be found in like a Target or Walmart, or is that to be ordered specialty item? And then what would ages be for the first toothbrush and maybe the first visit to the dentist as well?
So around, once they're old enough to hold a cup or a bottle is a good age. So probably around 3 months. That's a good age to buy one of these toothbrushes. You can usually find them at your local drugstore, CVS, Walmart, Rite Aid, those sorts of things. But everything's on Amazon as we know. So so you can easily find it on Amazon as well. So getting one of those, and then once they're able to hold it, that's a good age to just give it to them and let them kind of chew on it and just start to get comfortable with that.
And then what age is the first toothbrush be? Should that be like coinciding with like the first teeth? And then how about the doctor's appointments as well?
You can start even before they have teeth with one of these toothbrushes, again, just to get them comfortable with having it in their mouth. So normally the first tooth comes in around 6 months. So by around 3 months is a good time to buy one of these infant toothbrushes. Let them start kind of playing around with it, getting comfortable with having that in their mouth. And then that way, by 6 months, when they start getting their teeth, they're already used to it. They have 3 months of training where they can, it's more of a comfort thing even at 6 months. So some parents don't even realize or think, oh, they have teeth, that's so cute, I need to start brushing them right away, right? So so that's really a common oversight, which is why, to your other question, the American Academy of Pediatric Dentistry recommends that you do get your child in 6 months after their first tooth erupts. So normally around a year old is a good time to bring them into a pediatric dentist, just so that we can go over some of the little tips and tricks. And that first visit is more about educating parents than it really is about cleaning your child's teeth.
Makes sense. But okay, that being said, and obviously it's for the parents, and also I think just to get into the routine of going to the dentist, what are some things that us as parents can do preventatively that can really make sure that, forget about the costs, but more like the phobias are really taken care of at home?
Getting them comfortable with it is number one. With the toothbrush, making it part of the daily routine. Like we said, stopping the bottle at least with milk in it at bedtime. We don't want the baby to be sitting there once they have teeth with a bottle with milk in it, because there are sugars in milk. Certainly not juice. Don't ever put juice in a bottle. But even milk, even breast milk, can cause cavities. So that's kind of a bit of a misconception for parents, and sometimes even pediatricians and other doctors and so forth will even tell that you don't have to worry if you're nursing about cavities. But the mother's diet has everything to do with what's transferred in the breast milk. So if the mother does have a high sugar diet, they're definitely going to transfer sugar to the baby. And once they have teeth, because when the babies are nursing, the feedings are more frequent, it does increase your risk for the child getting cavities. So again, after each bottle, if it's anything but water in there, it's nice just to wipe the teeth down. That's an ideal world. But even just at bedtime would be fantastic. Just to, after the last feeding, if it's anything except water, just wipe the teeth down. Even if it's with a washcloth, that's fine. Just to kind of get the sugars from the bottle or the breast milk.
So it should be something dry that it should be used in order to just wipe off teeth?
Yeah, you could just use a washcloth, or you can use a toothbrush. You don't even need toothpaste. The most important thing is just that you're actually
getting off the stuff that's there.
Yeah, actually getting off any of the sugars or carbohydrates, anything like that could be on the teeth once, because babies are starting to eat other foods early on now too. So just nice to just get a little wipe down or a scrubbing in there before bedtime, so that those hours that they're sleeping, that there's nothing that could cause any damage to the teeth in there.
That makes sense. I'm curious, if you could touch on a little bit more. You're talking about what mom eats is going to directly correlate to what the baby is going to be getting.
Right.
Are there certain foods when it comes to the teeth hygiene, teeth care, that parents or moms should be looking out for, or maybe in general within the household, to obviously, the sugars and stuff, but maybe a little more specific, that parents should be wary of, or at least be aware of when it comes to oral hygiene?
Absolutely. You don't want to use any juice of any sort. That's a big one. Even your organic juices, still, that doesn't mean there's no sugar. It doesn't mean that the sugar that's in it is even much better. Sugar is sugar. So So we don't even want to touch juice. And believe me, once our kids taste that sweet juice, it's hard to go back to giving them water because sugar is also addictive. So the longer that you can avoid liquid sugars, that's a big one. Yeah.
Okay, that makes sense. I'm even thinking, like, my toddler really likes apple juice, but like we even watering it
Right.
down, to make sure not to have that at night. We're not saying to restrict in that sense. And I know there are, whether it's doctors or nutritionists or dietitians that are, anti juices across the board forever and ever. And I think in reality, it's still being sold all around the world
And your
for a
kid's
reason,
going
and
to
it's
have
gonna
it.
be there.
They're going to get
Exactly.
even if they don't get it at home, once they're in daycare or at school and they taste it, they're going to want it because it does taste a lot better. So you're doing a good job diluting it. But even if, trying just to limit what they're getting at home and starting those good habits at home with mostly just water at home would be good. Because again, they are going to get it at school. So they can have their little treats at school, but you're at home now. We're not going down that path. Sorry, our rules at home are just water.
Are there other tooth-friendly snacks that parents can feed their kids at home?
So pretzels, even goldfish, things like that, have they're a little bit more wheat based, and less of the other added, sucrose and fructose and cornstarch, those sorts of sugars. So those sorts of things are not as bad. Most of the pouches, a lot of the toddlers love those pouches, and they're easy.
Applesauce is right.
And I'm guilty as a parent also, because when you're on the move, it's really easy to give them a pouch, or a lollipop. I mean, because that gives you a long time. But lollipops, if you think about the release of sugar in the mouth, if they're sucking on that lollipop for a half hour, that's a long time to expose the mouth to the sugar, which then the bacteria in your mouth attacks the sugar, and the byproduct is acid. So you're creating a really acidic environment, and that's what actually is going to cause cavities and the holes in the teeth. So the longevity of how long the sugar's in the mouth also has something to do with it, which is why if they're sitting there with the bottle for a long time, you're increasing your risk, as well as just having a quick snack followed by a water, which will kind of dilute all the sugars.
Okay, that makes a lot of sense. How about fruits and vegetables? Are there certain ones that we should be staying away from?
Well, our vegetables obviously have less sugar than our fruits in it. But natural fruit, I mean, there's so many good things and good vitamins in fruit that, I don't really advise parents away from too many fruits, just because, they're giving the kids so many nutrients that they need to grow up healthy. But again, the closer that we get to bedtime, the more we want to stay away from those sorts of foods and just kind of getting into things that have less sugar. So those sorts of natural fruits and vegetables are fantastic throughout the day. But I try to advise parents, the closer you get to bedtime, the better it is to do more of the vegetables, or, more of the things that don't have sugar in it. Because if that's the last thing that they're getting before bed, that's going to have more of a
That makes a lot
problem.
of sense. I want to go back to what we were talking before about the bottle, having stuff in the bottle, and especially the milk. Well, I think sometimes a kid, it's part of their psyche to wind down at night is to sort of have that bottle. And I think, at least for some of my older kids, I remember giving you even just like a water bottle just for them. Okay, now that means you get this when we go to bed, and now let's start the winding down. Is there an age where the bottle itself should be stopping regarding the oral health? And does the same thing apply to pacifier, the pacifier, or like I like to call it, the mute button?
Yeah. So by age 2, we want those sorts of non-nutritive sucking habits like the pacifier to go away. And I include the bottle in that as well at age 2, because what happens if they're really sucking on it for any extended length of time, not only is what's in the bottle, like we talked about, is most important as far as cavities are concerned, but the sucking for a long period of time like that will actually change the shape of their jaw. So just like in your head, the babies have soft spots that get harder as they grow. You have a soft spot in your palate, right in the middle of your palate. You have 2 palatal shelves and there's cartilage in the middle. And if they're sucking on a binky or a bottle past 2 years old, it'll cave in the upper jaw to become more narrow than the lower jaw, and cause some, cross bite issues or open bite issues where they bite on the back teeth, but the front teeth stop. And now those kids can't use the front teeth to cut through our food when they bite on it. And they start to have to put it in the side of their mouth to bite through instead of using those front teeth to bite through it. So it leads to other skeletal, the jaw structure abnormalities that can be fixed later. So I don't ever want to freak parents out.
Right.
But then, they're going to need, that's where the phase 1 orthodontics comes in, this early interventional orthodontics to fix the jaw structure. So typically, if you can get your kids off the bottle or the binky by 2 years of age, there aren't any skeletal changes, or any skeletal changes that are starting can bounce back on their own without needing that interceptive orthodontics, which starts pretty young, around age 7. So,
that was going to be my next question of what and when can parents start looking out for when it comes to, I need to take my my child to a maybe oral surgeon or to see if they need braces or a bite plate or something. Like, what signs can people see, and what ages should they start looking out for this stuff?
So most pediatric dentists I try to guide my parents in that process very early on. If I see any early indicators that they're going to be needing that in the future, I point that out. And sometimes it's just genetic, different sorts of bites and things like that. We get that gets passed down. So, but I have a little theory about that now that we're able to fix a lot of these skeletal issues. I think those genes are actually being passed on more, and that's why we see more kids that actually need more orthodontic care, than in the past. Far in the past, when those things weren't fixed. Really, we were not as attractive, and we probably were not breeding as much. But now that we can get these bites fixed and have our teeth straight, that's not a question that we bring up when we're dating and thinking about, a spouse and having kids, because we see the finished product, but those genes are kind of passed on a little bit more now. So we're seeing more kids with these crowding and bite issues, also because those genes are because we're able to fix it now. We don't get to actually see those issues before you have kids, but around, the pediatric dentist should give you a little bit of insight on that early on. You can see a lot of these bite discrepancies and or crowding or skeletal issues. I can, like, when I see a kid smile, at the pool, I'll be, oh, that kid's got this going on. So I don't want to, inform the parents. I don't want to let the parents be shocked when they're 7. Oh my gosh, why do they have to go see an orthodontist? So I try to give them a heads up on those things earlier on, so it's not a surprise when I finally tell them and I explain why.
It makes a lot of sense. And I'm thinking about also as being a psychotherapist and obviously dealing with a lot of stress and anxiety. I think one of the places where people feel their anxiety is in their upper body and their head, and like the tension and the tightness. And I think a lot of it does come in the jaw, and whether it's TMJ or other things. I'm curious what you've seen from your practice regarding the correlation between the anxiety the kids have and what's going on inside their mouth, and what treatments can be done for that, and also maybe what preventative care is probably more important can be done that us parents can do.
So grinding the teeth is a very, very common way that we express our stress. So a lot of adults do it. A lot of kids do it also. About 50% of kids actually do grind their teeth. And parents do get very worried about that because a lot of our kids sleep with us, and you can hear it. And grinding the enamel together really sounds pretty brutal. I mean, it's really loud, and it sounds worse than it really is. Luckily, our outer hard shell of our teeth, the enamel, is the hardest structure in our body, so it does take some time to wear through it. But on baby teeth, that layer's a lot more thin than adult teeth, so we do get through the outer coating quicker. But fortunately, for the kids, it doesn't normally cause any sensitivity or pain. If you have something cold as an adult and you're a grinder, you'll get some sensitivity. The baby teeth don't behave that way typically, so it's not quite as much a concern. But again, if the bite is off, like we talked about, then it's easier to wear those teeth. But these kids kids can have anxiety too, even at a young age. So if I start to see some wear on the teeth, I'll ask the parents, if they're happy in school or if anything's bothering them or if they're having nightmares, because I, want the parents to ask some of these questions to the kids. And if none of the above things are an issue, sometimes it's just a habit. Sometimes it can be related to sinus issues or allergies or congestion, which you can tell I have. Yep, the spring is here and it's, really hurting me right now. But for kids, when we're breathing through our mouth and we're all congested, we have a tendency of even for adults too, we have a tendency of clenching a little bit more in our sleep. So it doesn't always have to be something, psychological that could be bothering us. It could be a physical thing too.
So are there preventative things that we can do when our kids are clenching or grinding, besides for wearing a mouth guard, that I guess parents can try to do together with their kids to help alleviate some of that inner pain?
Right. So we don't recommend night guards for kids because we actually want the jaw to continue to grow. And if you put something in there that's restricting it, their jaw is not going to grow properly. And one of two things are going to happen. If they're very consistent about putting it in, it'll restrict the growth of the mouth. If they're not, in 3 months, it's not even going to fit anymore. So we don't really go down that path. But if it's allergy related, you could just give your kid some allergy medicine or just give them like a little saline rinse in the nose to help them kind of try to clear their sinuses and breathe a little better at night. And if it's something that's psychological, that's when we can just try to talk to our kids and ask them, is anything bothering you? Things like that. Are you having bad dreams? And trying to get to the root cause of if something is bothering.
Are there times where you'll ask the kids directly instead of asking the parents? Because I think sometimes us parents, and I'm probably guilty of this as well, are just a little overprotective. Like, no, my kid's fine at school, or they're not having any bad dreams. And there are telltale signs that you're saying that come up within the child. So would you ask them directly?
I guess it kind of depends on the age, but and in my practice, we have the parents with the kids from start to finish, no matter what we're really doing. So it is a little hard. And then parents, a lot of times, if I ask a child directly, parents will answer for them. So so that it is tough to kind of get to get an honest answer from a child, especially when the parent's right next to them. And some kids might be nervous, saying certain things in front of the parents. They don't want to get their parents upset that something might be bothering them, or so that is tough with kids, and they're so inconsistent. I mean, even when a child comes in pain, mom will say, "Oh, it hurts on the bottom right," and the kid will say, "Oh, it hurts on the top left." And it's like, all right, we got to just kind of do a little bit of digging and investigating on our own, because kids are pretty inconsistent with that.
Right, I hear that. That makes a lot of sense. So you were talking before about the strengthening of the teeth. Can you, when it comes to, let's say, fluoride and sealants, which are obviously important, are there certain ages where we should start putting that into our kids' nightly routine? And are there certain types of toothpaste that we should be looking for in general? And maybe at what ages should we be start to be implementing this into a child's
That's
routine?
a great question, and that's one that kind of keeps evolving and changing over time. So, but my philosophy, and I think a good philosophy that should be recommended for kids, is that anything in moderation is okay. So even if you do use a toothpaste with fluoride in it at a young age, if you have to really treat it like a controlled substance. So you're not going to give a kid 3 teaspoons of Motrin when they're 6 months old. You don't want to give them a huge glob of toothpaste that an adult would use, because they're going to be swallowing all of it. So, and even the safe to swallow toothpaste, if you read the ingredients on them, if you can't understand and read the words that are in these products, you probably want to limit how much you're swallowing of it. So I even with the safe to swallow non-fluoride toothpaste, I do recommend to parents to use just a very tiny amount. They can use one with fluoride again if they treat it like a controlled substance and use no more than, at a young age, 6 months or so, half a grain of rice, maybe getting into a grain of rice amount, when they're a year and a half, and keeping that amount until they are good at spitting. And then you can get into the pea-sized amount, which was kind of the more traditional recommendation with that.
Okay, so on this topic of toothpaste, I know my kids, two of my kids are 9 and 10 years old, and they still want that bubblegum flavored. Like,
Yep.
because, the mint is disgusting. Is there a certain age where, like, all right, like, grow up a little bit and just, like, have a little bit of a toothpaste? Or is it, similar to what you're saying, is that if they're used to something and it's working for them and they're doing it, stick to that. And if that's what they need, that's okay.
Well, I tell parents that the best toothpaste is the one that your kids use the most.
Okay.
So the one if they like this toothpaste and they're going to get in there and scrub their teeth better and longer, then that's the best toothpaste. So because the most important thing in this whole process is physically scrubbing and removing the plaque from the teeth. The toothpaste is kind of an adjunct to that, but it's nowhere near as important as actually getting in there and scrubbing. So the bottom line is the best toothpaste is the one that your kid is going to brush their teeth the most thoroughly with.
Love that. That makes a lot of sense. And I guess just to add to what you were saying right before, when it comes to ingredients on snacks or something that we might buy in the store, if you can't pronounce what it says in there, it's probably not something we should be eating. So why would we put it in our mouths in the first place? So I that resonates with me when you talk about having stuff in our mouth, making sure that it's something we can use.
Yeah, it's really hard because everything is processed now. It's really hard to find, like you brought up, just fruits and vegetables, even those are genetically modified now. I mean, it's really, but at least there's not added, sugars and ingredients in them, pesticides, things
Right.
like that. I mean, you can go crazy with, if you really start going down the rabbit hole with our food, but the bagged, anything that's in a package, there's the more ingredients that are listed, probably the worse
the scarier it might be.
It is, yeah.
And
it's very hard to avoid. I mean, it's really impossible.
Right. 100%. And I think when it comes to the toothpaste, another thing that comes up, and I think about this every time, whether I'm ordering something on Amazon or I'm in a Target or CVS, and like you see the price difference, and you're looking at, something you get 3 for $5, and it's my kid's favorite flavor, and I know they're going to use it. Or you have something that has 5 ingredients that they say is on it, then it's $6.99, and so for one bottle.
Oh, it's major.
So you're like, I don't know, what should I do here? And the conscious part of me and the frugal part of me is like, well, I got 3 in one over here, and they're going to use this one. And I'm hearing you talk, and you're like, well, you're that other angel on my shoulder saying, well, maybe get to one that you could read the ingredients and use that one. It's
doubling or tripling the price when you do that. So that's an issue too.
But that's why I think if we have that mindset of, I need to do what is best for my child right now, if they're going to use something that they're going to use, then that's what I should be going with, because that's the most important thing. And I think that's a very, very good mentality for us to have, knowing that if your kid's going to brush their teeth, make sure they brush their teeth, buy them whatever they need. So if they need that Paw Patrol toothbrush, buy it for them, because that's what's going to make them brush. Let's talk a little bit about flossing. What age? What is the proper technique? And how often should parents make sure that their kids are starting to floss?
So once all the baby teeth are in, that's a good age to start flossing. If the front teeth are really tight and touching, you could try to get in there. So that might be a little bit younger, but typically all the teeth are in around 2.5 or 3. And the most common areas to get cavities in between the baby teeth are in between the back molars. So those are the baby teeth are the contact area is much more broad and flat. So an adult tooth might only touch like this. Baby teeth are going to touch like that. So there's a lot more surface area that's not getting cleaned when the teeth are tight in the mouth. with baby teeth than adult teeth. And like I brought up earlier, that hard outer shell is more thin on baby teeth. So around 3, if those back molars, and most kids, the back molars are touching, is a good time to start getting in between those 4 areas, 1, 2, 3, and 4. Unless they're younger and they're really crowded with the front teeth, then you could try to get in between the front teeth a little bit. But yeah, so that's a good age to start with that. And how often, if I say every other day, most parents will do it once a week. If I say do it once a week, we do it once a month. So if we say every day and we get it a few times a week, that's great.
You must be a parent. Yeah.
Yeah.
I
have 2 girls.
There we go. That makes sense. That was there he goes. And I'm sure, dad is really on top of them regarding making sure that they're doing things, because it's like
I try.
Yeah.
I try, and now as a parent, I also try to give them, I give them the advice, but I don't want to be too strict, with watching them every second. So it is, being a parent is very hard, and we all try to do our best in different ways. But yeah, I try to give them, I had them doing their own breakfast since kindergarten and things like that, because I feel like, it is important for them to learn how to do some of these things on their own.
For sure.
And reminders are necessary. Yeah, reminders are absolutely necessary. But I remind you, and then it's all right. It's on you to complete the task now.
That's a very good
more
point.
Or less.
That is a very, very good point, because I think our job as parents is not for turn our kids into robots, but to turn them into autonomous beings that are respectful and are responsible for themselves and are doing the best version of themselves. Exactly. And that's what our role is. So I'm curious, that being a parent, and obviously of kids that are there's so much changing them developmentally as they get older. Are there things that you've sort of either helped enhance your practice or helped you being a dentist now that you've been a parent and having these 2 girls that maybe not only did you not learn in school, but you never had in your practice before, but now that you've had the kids and you have their experience in your back pocket, that
right.
sort of helped enhance how you practice being a dentist?
Absolutely. I mean, getting into pediatric dentistry, I think you automatically have to have compassion for kids. Not everybody does, unfortunately. I don't think a lot of people are suited to being pediatric dentists, if I'm being honest. A lot of people resort to, oh, well, if this kid's moving or getting upset, let's just give them more drugs to put them to sleep. And instead of trying to, and that really does happen a lot. But our job really should be to try to minimize the sedation and the things like that for kids, instead of, but being a parent on my own has certainly given me more patience with other people's kids, not my own, unfortunately. I think dealing with other people's kids all day makes me less patient when I get home, for my own kids, unfortunately. But it has, definitely shown me that, helped me see, every child is different, and my approach for trying to calm children, sometimes you have to read the room a little bit, read the child, read the parents, and most of the times being their friend works. I'm not going to hurt you if you're anything scared of. Give me a chance. I promise, we can make this easy. And then you do the work, don't hurt them. And then you build on that sort of trusting experience. As opposed to, it used to be sit down and listen. And if you don't, it used to be more of a negative reinforcement. And now we're kind of focused more on positive reinforcement. If you do this, you get a prize, those sorts of things.
I remember growing up with all the stickers we used to get. And now I see my kids come home from the dentist. It's a lot more than just stickers that they're getting, it's not working the same. So
right.
It's interesting you bring that up, because I think what I'm seeing now, and when I take my kids to the dentist, is that, there's more electronics, whether there's a VR in certain rooms, or might have a TV on the ceiling so that, they can distract themselves. And obviously,
Right.
it is helpful. And as parents, we do use the tablet sometimes as babysitting. Along with that comes snacking, comes mindless eating,
Of course.
which has a huge impact
Oh,
when it
yeah.
comes to our kids' oral hygiene. And I'm curious if you could give some direction, whether
Right.
it's something you do on your own or something that you've sort of picked up to you would tell parents that can be of benefit, so that even though there is going to be that mindless eating, but yet there could still be a chance for things not to go haywire.
And it's difficult. So, you know, and the frequency of snacking increases your risk for cavities too. So if they are doing a lot of snacking, the brushing after breakfast is important, and then obviously right before bedtime, like we talked. But if they're really doing a lot of snacking, another one would be ideal, but again, difficult. So it's a tough one to kind of guide, through the snacking and so forth. Yeah, that's a tough one.
Okay. Yeah, it is. I'm always curious to hear what people have to say to that, and people what they do at home, because
gonna
I think
be
it's something that it's a part of what reality
right.
is. And it is what it is, and it's more about just being as mindful and as aware and as conscious of it as possible, even though it's going to be that mindless activity that's going to be there, and just being on top of it. But I think when it comes to other sorts of care that we can have for our kids, and I'm thinking specifically, we were talking about before about mouth guards and stuff. Let's say you have kids that are playing contact sports, which is fairly common for mouth guards. I'm curious, if there's any direction regarding how to find the right type of mouth guard, and any other direction regarding the mouth guard or care for teeth and oral in general, or oral hygiene and oral taking care of things when we're playing sports, and there's going to be contact involved.
Once you start to get your adult teeth, and they're playing contact sports, it's good to start wearing a mouth guard. They do make kid-sized mouth guards. Probably just those boil and bite ones are best while they're young, because they're going to lose it. It's not really worth, and even getting an impression or a scan to make a custom one is going to be difficult at a young age. So just getting those ones that you put in hot water and you try it in, and then you cut it and you put it back in water and you cut it and try to make it comfortable and fit as tight as you can. Those are fine, while they're still, 8 years old is when they have, all four of their top teeth there, which are the most common ones to injure. So they start coming in around 7. But by the time they're all the way in, it's about 8 years old. So that would be probably a good age if they're doing contact sports. And wearing them also cuts down on concussions, which aren't that common in young kids like that, but still, another benefit to wearing it.
For sure. And that goes a very, very long way. So yeah, I totally forgot about those boil and bite ones. I've not seen those in a really long time, but for sure something that I think parents can really benefit from using properly together with their kids. And I on this point of obviously things changing and developmentally, the way the body changing as well, how can a parent differentiate between the developmental changes in a child, that things that might need just different types of care at home, as opposed to seeing a professional that might require their attention?
I coughed during a critical part of that question. I'm sorry.
Oh, it's okay. So we're talking about changing of the teeth. We're talking about how a person developmentally changes, and therefore the mouth guard will have to come into play. So I'm curious, when we're talking about developmentally changes happening to a child, there are certain things that have to change regarding the care of their teeth as well. At what point and what signs should a parent look out for to say, okay, now I'm seeing these certain changes, whether it's teeth growing a certain way or the bite? I grew up with a Jay Leno jaw, as it was called. So that's something that by parents can look out for. But I'm curious, what are those specific signs that a parents can look out for to say, that needs professional help, that needs care from a professional, and what things you can say, no, we can take care of this at home, we can do certain things at home?
So I really think that's more up to the child's dentist to kind of guide through that. And every checkup, they should kind of take a look at at the jaw structure and the bite and the spacing and the risk for cavities, and kind of go over some of that stuff with the parents. But something that parents can look for at home would really just be, and as they're growing, to see, like you said, like you had, a strong jaw, or the jaw's too far back, things like that, that most parents can kind of see, that something is a little bit off, with the growth and development there. So those sorts of things should be pretty easy for parents to spot. But again, their routine visits, I think the most important thing here is just, try to get your kids in every 6 months to their pediatric dentist, so that they can kind of guide the parents along, because this is our specialty, and you as parents can't know everything, so if you're just doing good with your routine care and going in for your checkups twice a year, you should get adequate guidance from the pediatric dentist on different issues or risk factors or things like that.
And these things are constantly changing. So I think also having that checkup will be helpful to that, to make sure that we're doing the right thing.
Oh, yeah, exactly. More teeth are coming out. Things might be coming in crooked. There might be crowding, other things like that we can spot.
And talking about some of the things that are changing, I think a trend that I've been hearing about, Lisa, recently, are we call tattooed teeth, or some version of that, right? When it comes to teeth jewelry, and things, kids wanting to have a certain, I guess you could say, way of having an expression of something on their teeth. I'm curious. This is not, as much as I work with adolescents in general, this is a new phenomenon that I'm curious if maybe you can give me and us a little bit of an education regarding what it is, what us parents can know about it, and the proper way to go about it if it's a decision that our child and the parents are decided.
I usually steer clear of those sorts of things in general, but I have seen even dyes like that, the white filling materials. I've seen kids that, you can put a little like coloring in the white material, so I got a pink tooth, filling or something like that, even in the back, but yeah, I don't do that in my practice. I don't think too many. If you don't give those sorts of options to the parents, they won't think about it anyway. But some of the kids, like you said, since it's trending, might bring it up. But yeah, once they know that that's really not an option at my practice, those questions kind of go away.
Right. Yeah. I think I called it, the tattoo teeth. I think it's like tooth jewelry, something that I'm seeing a lot of now, or wanting to do certain things.
Different shiny things or whatever on the teeth. And but yeah, don't really do any of that. Yeah.
Right. And I think, like you said, it's a lot of this is a fad, and it's the things that the kids may be seeing that they want to do for themselves based on what other people are doing. And obviously, I think when you have that collaboration with a professional that can sort of help guide how to go about doing it, if you're going to do it at all. But that being said, there's obviously, I think there's a lot more things that we can talk about. But as I'm sort of winding down over here, I think my last question for right now is, we talk about so many different strategies, so many different things that are important for us as parents to try to do, try to implement, to try to realize on our own, to go ahead and nap out with our kids. What are some effective strategies for motivating our children and young adolescents to take their own responsibility for their own oral health care, whether it comes to brushing, flossing, and as they grow older? What are some of the things that we can do as parents that can really be a benefit to their long-term care for their own teeth?
So one would be talking about the diet, and good foods versus bad foods. I think, when you talk about those things early on, at least they're aware. And our school, my kids go to the public school here where we live, and they start talking about diet in kindergarten, which is fantastic. I didn't get any of that. I mean, all the nuns when I went to school were drinking Pepsi and so forth. So there was really none of that talk back then. So I do think kids are introduced to health and well-being at a younger age now, which is fantastic. And they're definitely doing that at most schools now. So supplementing that at home kind of reinforces it for the kids that, okay, Mr. or Mrs. So-and-so at school said this, and mom and dad say the same thing. Like, wow, you're not an idiot, Dad. You actually know what you're talking about. because they're typically,
I'm still waiting for those words to be said.
yeah, they typically listen to other people more than they listen to the parents at certain ages. So, but when we can reinforce that at home, that goes a long way. And then getting them into those early habits of, just being comfortable with the toothbrush, and brushing, at least every night before bed, and drinking more water and less of the sugary drinks, those sorts of things, go a long way. And then again, adding the floss in there when they have contacts in between their teeth too. So,
Okay, that makes a lot of sense. Are there any topics or any specific details of stuff when it comes to teeth that we haven't talked about you feel it might be important just to mention in the last few minutes over here?
man, I think you're pretty thorough, to be honest with you. You're very thorough. But yeah, these are all topics that during the course of my everyday at the office that, different parents will bring up questions about this stuff. So it's nice to have these conversations is important for parents.
Yeah.
So, but yeah, really talked about a lot, structure, habits.
Yeah. Oh yeah. Yeah.
Hygiene. Yeah. I mean, you're very thorough.
Okay, I think a lot of it comes down to a topic we talk about here on this podcast, a lot of ABC. I'll always be curious, and the more curious we are of things that are happening, that really helps how we go about making sure that the health for orally and mentally and emotionally is going to be really up to par for whatever the child needs in that situation. Doctor, before we sort of finish with the rapid fire questions out here, I'm curious if you could just give us a little layout of where people can find you and where your practices, maybe online, how people can hear more about you.
So my website is pretty simple. I tried to make it that way so it would be easy to find, but it's Best Dentist number 4 Kids. So that's the name of the website. And so again, it's pretty easy to find. But in Philadelphia, and then in Montgomery County, in Hatboro, which is a suburb of Philadelphia, and then we'll be opening in like the next month in Montgomeryville, which is near like Lansdale, another suburb from Philadelphia. So. But yeah, so pretty easy to find us. And yeah, even my associates that come in, we all have the same philosophy, to treat the kids like they're our own. And I did want to hit on that a little bit when you brought that up earlier about, me being a parent. Once you're a parent, you realize, how much you love this child. And just like any job, it's very easy to take for granted when you do it over and over and over and over again. But I really pride myself in trying to give every kid a good experience and treat them. Really, I'm nicer to my patients than my kids. But treat them, the way that you would want somebody else to treat your own child. And I love it when I have patients that call me Uncle Mike instead of Dr. Mike. It really means a lot to me because that is like a really core piece for me is to like, I'm your extended family. I'm your home. And if your kid really is that comfortable with me that they're calling me their uncle, that's really rewarding. So
that's awesome. It's the ultimate compliment because it shows the work that you're trying to give over is really coming to fruition in that uncle. So as we finish up over here, I have a few rapid fire questions over here. My first one, if you can think of a character from history over the past 100 years that you would like to have lunch with together with your family, who would that be? But it cannot be a family member.
Together with the family. Mm-hmm. Oh man. I mean, right now, Taylor Swift is very popular in my house. So it's not even really a historical figure. But she does seem like a good person also, and a good influence for kids. So, that would be so special for my girls that would probably be, I would do it more for them than for myself. Sacrifice that. Yeah.
Okay. Is there a book or a podcast or something that you would recommend parents, or maybe just in general, it doesn't have to be about parenting, that you've either read recently or that you would recommend to others?
Well, I mean, I would listen to your podcast because you have a lot of good. So But there's I mean, from a parent perspective, I always love the giving tree just because it's kind of shows you how much you know, how much a parent can give, to their child. Um, uh, yeah, that's kind of a classic that I.
Yeah, that's a good one. That's a really good one. Two more quick questions over here. If you could create a special holiday just for parents, what would it be called and how would it be celebrated?
These are great. I guess it maybe we have a day, kids a smile day, that we give back to kids in need and do some free dental care, things like that. But I feel like it would be nice to have a day like that for parents, where maybe there's a day to give parents a smile, and not even from a dental perspective, but just a day where maybe the kids can sit down and I love talking to my kids about everything pretty much. So, but a day where you can sit down and maybe have the parents can ask their kids some questions about how their feelings about how they're doing as a parent and things like that. Because we really don't ask our kids that. Like, are there things you want me to change, as a parent? Those sorts of things, and the self-awareness, I think, as a parent, to even ask your kids that, because we all do it the way we want to, but we don't really get feedback from our kids on that. I think that would be a pretty neat idea.
That'd be great. I love that idea. That is really awesome. And my last question for you, Doc, over here as we finish up, if you could think of an everyday mundane superpower that you would like to have to help with your parenting, what would that be?
To help with my parenting. Oh, wow. I don't want to read their minds. That would be that could be really trying.
Agreed.
That would be a negative on that. What would I want? Oh wow. Maybe to be a better listener. If that would be, I think as parents we sometimes don't listen good enough. So maybe to be a better listener, that would be nice.
If I could tell you how many times people have given that as an answer, like it's amazing, and it's
Really?
so moving to hear that, and it's like such words that I need to hear as a parent that I think I have to start giving that as my answer when I ask these questions as well. But yeah, that's such a great answer. It's a really good answer.
That's
Well, this has
Thank
been
you.
absolutely amazing, Dr. Mike. Thank you so much, and look forward to future conversations.